Good afternoon, Mr. Cole, Jason. Hi, my name is Bon Jovi Bvalarao, and I get to be the respiratory therapist that gets to follow up on your home health care plan. So, my goal today is to talk to you guys about how everything's been going on at home, what works and what doesn't work. Earlier, I was able to review your history and your charting, and it seems that in the past 6 months, you guys went to go visit a clinic, and at the doctor, you guys discussed you were suspicious that Jason may have some sleep apnea. It appears that during that time, Jason has had a lot more what you guys call events of waking up in the middle of the night, gasping for air, and you guys have also noticed that his snoring was getting a lot louder. Okay, okay, that makes sense. And according to his daytime caregiver, Jamie, she says that he's been a lot more irritable during the day, and it's as if he was always tired. Is that correct? Yeah. Okay. Reviewing the doctor's note, it did appear that you guys did get the sleep study. Excellent. It also notes that Jason has a significant amount of weight gain over the past 2 years, going from 165 pounds to 210 pounds. Okay, that's quite a lot. I'll ask more about that in a minute. While I'm reviewing his sleep study, it shows an AHI of about 8 events per hour. Okay, respirations show very little effort with a thoracic belt and hypoxia, and frequent arousals and awakenings throughout the study. Okay, it seems that Jason has been diagnosed with central sleep apnea as well as obstructive sleep apnea, with the recommendation of a BiPAP at night with the following settings of spontaneous time mode with an IPAP of 12, EPAP of 6, backup rate of 12, and an I time of 1.2. Is that correct? Huh. So it's been 3 months now. How are things going? What are some specific challenges you guys have faced or observed with Jason's new sleep pattern? I don't know, Jovi. It's everything has been challenging since the diagnosis. Jason's been with us for 19 years. We knew what we were getting into when he was first born with the mental disability and possible learning disabilities, and as well his growing up non-communicative. Luckily, he's always been non-combative up until now. Initially, we were worried about placing the mask on him and it would bother him, but for the first 3 nights, surprisingly, it didn't bother him and he was completely fine, which we kind of deemed the honeymoon phase. Then he would start swatting the mask off his face whenever he sees us trying to put it on, and it, he's not a peaceful sleeper. He tends to turn around a lot and the mask falls off and it requires a lot of adjustments throughout the night. The caregiver, Jamie, she has also noted that the BiPAP does seem to help during the day, and we also agree. We can actually tell whether he's had some full rest with the BiPAP on versus when he's not. However, there are the hard nights where, as a parent, we feel like we're making Jason suffer by putting on the mask, and because of that, we honestly feel like we've been a lot less consistent with the therapy. He was easy before, but like I said, now he's a lot more challenging. He now wears it maybe twice a week if lucky. Because of this inconsistency, we feel like we're all the way back to square one. He's irritable during the day and stays awake most of the night. Yeah, that does sound like a challenging situation. What have you guys tried so far to help Jason sleep better? What's worked and what hasn't? Well, my wife and I think that the mask is his biggest issue. We feel that he gets afraid whenever he sees us approach him with a mask. I think it's all the pressures as well as all the airs whirring, going in and out of the device, just scares him. My wife and I did look into some options online, and we did discover a device where it looked more like a jelly gel nasal mask, where it just sits in front of the nose rather than covering his entire nose and mouth. We were kind of hoping to discuss this with you and see if this could be a great alternative for Jason to use at night rather than the full face mask. As suggested in the past as well, we tried putting the mask on an hour before he goes into deep sleep, hoping for him to acclimate on the settings. However, this only worked for the first 3-ish days, and then he started becoming a lot more combative. Jamie, our daytime caregiver, actually had this little technique where she would try putting him on, and then he would fight her a little bit, and start crying. And once he starts crying, we wait for him to to get a little bit more consolable. He goes into a deeper sleep, and then that's when she puts the mask back on before she goes home for the night. That seems to work, but as a parent, we hate the idea of having to put on a mask or while he's crying or anything to irritate him. It's very frustrating. And honestly, what frustrates us most is we don't understand why this is all happening now. Jason's been with us for 19 years, and why are we getting all these newer issues? Like, he's been sleeping fine in the past. Why now? Why do we have to do this? Your frustration, Mr. Cole, is very reasonable. In my years of working in medicine, I've been lucky to work with other cases just like yours. And every single one of you is a good person who wants what's best for their loved ones. The beauty of medicine is it's not a one glove fits all situation. So it is part of my responsibility to find and tailor the best home health care plan for you and Jason. Aside from Jason's comfort, are there any other barriers that prevent us from improving Jason's sleep? Well, there's honestly some nights where my wife and I are a little too exhausted to try to fight with Jason by putting on the mask. I know it sounds a bit selfish, but we're starting to feel a little bit burnt out from trying. My wife and I have actually had a conversation about getting an overnight caregiver, someone that can be a lot more attentive to Jason's needs while he's asleep. That way, everybody in the house gets the rest that they need. I appreciate your honesty, Mr. Cole, and I don't want you to feel bad about this. You're not the first person to feel like this, nor will you be the last. And I'm actually pretty glad that you're aware of how you feel. However, allow me to take this time to reiterate the value of what quality sleep can do for Jason. So between central sleep apnea and obstructive sleep apnea, central sleep apnea is characterized by pauses of breathing due to the lack of respiratory effort during sleep, while obstructive sleep apnea is a repetitive amount of partial obstructions occurring in the upper airway while at rest. Both leads to pauses of breathing, or what we call is apneas. And although the diagnosis of central sleep apnea is a lot more rare than obstructive sleep apnea, both conditions can often coexist, just as we see here in Jason. So what we've noticed is, if it wasn't for for Jason's presentation of obstruction, we wouldn't have been able to order the sleep study and also find out that he has central sleep apnea. Between the two, obstructive sleep apnea generally occurs when there's an increased amount of weight gain, as we've seen in Jason. A lot of fatty tissue gets to accumulate over here in the neck, causing obstruction while he's asleep. While central sleep apnea can be a little bit more complicated to explain, it does have the involvement of the brainstem, whose main job acts as the main respiratory center of the body. With central sleep apnea, this occurs when the control center fails to generate the necessary signals for the respiratory muscles to activate while asleep. And this is where Jason's BiPAP therapy comes into huge play. So the BiPAP helps him breathe while he's asleep with the backup rate. The backup rate of 12 ensures that he gets 12 breaths per minute at a minimum while in deep sleep. The IPAP, or the inspiratory pressure, occurs when it kind of simulates an inspiration breath when Jason's body doesn't want to do it himself. It inserts pressure into the lungs, inflating the lungs, and then at the end of that, it'll release. That's where EPAP comes into play. EPAP is an exertion of pressure that stays constant at the end of inhalation. That will not go below the number of 6, and that the reason why is anything below 6 can partially cause obstruction in his airway. So this EPAP is actually what's keeping his airway open as he sleeps, thus ensuring that Jason's body has better oxygenation and ventilation throughout the night. However, if obstructive sleep apnea and central sleep apnea are left untreated, this can create problems in the heart, lungs, and even the metabolic system. The biggest one is the heart. As the body becomes deprived of oxygen overnight due to the lack of respirations, the heart starts to compensate by working harder. Long-term overexertion of the heart can lead to hypertension, arrhythmias, and possibly even stroke later down the line. We can even notice increased irritability and cognitive impairment from Jason due to fragmented sleep. Chronic sleep deprivation and associated health issues can lead to general decline in well-being as well as life satisfaction. Allow me to give you some additional handouts with really great links to websites that can better educate users as well as caregivers on the device and the pathophysiology of obstructive and central sleep apnea. However, you are more than welcome to contact me at any point in time if you have any questions. Now that we reviewed the importance of BiPAP therapy, I would like for us to make a plan of your living situation. You mentioned earlier that possibly getting an around-the-clock caregiver can be a lot more helpful for Jason. I honestly think it's a great idea. However, I would like to know more from you. What makes you think that this is the best for your situation? Between my wife and I working full-time jobs and needing to use this device overnight for Jason, we think an extra set of hands can actually be a lot more helpful. Part of the challenge with being consistent with Jason's therapy is ensuring that the mask stays on overnight. My wife and I would wake up a couple of times throughout the night to just make sure that Jason's using it. Without fail, he's ripped it off his face. Sometimes we spend more time consoling him throughout the night, leading to a lot of restless evenings for my wife and I, which end up affecting our work performance. Mr. Cole, I completely agree. I think it's a great plan to begin with, and I personally need a full night's rest to be able to help families like yourselves. Let's also talk about your proposal for switching masks. I think it's another great idea. I have encountered a lot of patients who have actually done a lot better with BiPAP therapy, CPAP therapy, with using a nasal gel mask. I've noticed a lot of success with a lot of similar cases, and it's just so much easier for the patient to remove and put back on whenever they need to without disrupting their sleep, and it's just so much easier to maintain. So let me go ahead and touch base with the doctor and get an order for that change, and hopefully we can move forward with that. So from what we talked so far, how do you feel about the changes that we've discussed? Good. I feel good about this for Jason and us. It's just, I'm grateful that this meeting has been a lot more productive than I anticipated. And I just don't want to feel like a bad parent. I mean, we really did try our best, and sometimes, I don't know, the best we can't help to think that we've hurt Jason in this process. I feel bad. We do experience some level of guilt and shame. We do our best as a couple to talk about it, but we don't have any friends or anyone else we know that are going through the same thing. I know there are some support groups online. We've never really gotten a chance to open up to any of the people out there, so it's been hard. It has been hard. I do agree, Mr. Cole. There are plenty of support groups out there who meet both online and in person. However, there is another alternative that's actually been growing in popularity. Have you heard of group visits or shared medical appointments? Well, the way this works is actually there's one appointment, and they accept up to 10 patients at a time who are all similar in diagnosis. There's a multidisciplinary care team there with a doctor, a nurse, a dietitian, and whoever else needs to be there to discuss plans and cares for everyone involved. What's great about this is there are a lot more families out there who have more experience going to these and have a lot more experience with the disease itself, so you get to hear what they've gone through and how they've dealt with it. And seeing success stories like this help encourage other people feel a lot more motivated about their own care. I've actually heard of these, but I never really considered it as an option for us. I do like the idea of seeing other people in a group and kind of hearing their stories and seeing what they've been through. Yeah, I actually think it's a great idea. Excellent. Let me go ahead and speak to our front desk to see if there's any appointments available in the near future for you guys, and we'll set one up for you. Well, and then the last thing I do want to talk about is Jason's diet. How has he been eating at home, since we did notice that there's an increased weight gain with him within the past 2 years? Actually, on that part, we've actually been doing a lot better than being compliant with his mask. We have been able to control his diet a lot more better. We have a better feel of what he needs, what he doesn't need. We've been avoiding a lot of ultra processed foods for Jason, even though it's easy. Just because it's easy, we walked away from that, which is honestly one of the better things we've done. Our daytime caregiver, Jamie, is actually the one that prepares most of his meals nowadays, and they've been a lot more balanced. Honestly, I could probably benefit from eating what he's eating. Mr. Cole, that's great news. I'm great to hear that Jason's diet's working out for him. I think you look great. I don't think you need to do anything on your diet yourself, but it doesn't hurt to be a little bit more cautious of what we eat. Well, let's go ahead and take this time to review what we've discussed and start having some plans move forward. Today's session, we have spoke about what I believe are two reasonable barriers to Jason's sleep. The first of them was having a better understanding of what central sleep apnea and obstructive sleep apnea does to Jason right now and what can actually do to him in the future. And the second barrier, I believe, was a little bit of a living situation problem where it's very difficult to be able to keep Jason's mask on overnight, and this does affect you guys work the next morning. So I think the plan of one, changing his mask to a nasal mask is going to be very, very helpful. And two, if you guys do plan on moving forward with getting an overnight caregiver, it will guarantee that Jason gets the rest that he needs while you guys get the rest that you need. And today we've also discussed the benefits of shared medical appointments, which I really do hope that you and your family with Jason attend. I think it'll be very beneficial for all of you guys to get to see what other people are doing, and also builds a better dynamic with your medical team. So what I like to see from us is I'd like to see you guys again in a month. I want to set another appointment with you guys to see the progress we've made. I think changing the mask and getting an overnight caregiver is going to make a huge difference in Jason's day-to-day activities and rest. And I believe that we're going to see a huge difference in how he is in the next few weeks. So I'm looking forward to seeing that again. Do you guys happen to have any questions for me at this time? Is there anything I can clarify for you, Mr. Cole? No, Jovi, not at all. I think this was a very great meeting, and I'm very grateful to have you on our team. So thank you very much.